Here we have another very classic image, which honestly, if I saw this on the test, I would, and the question was diagnosis, I would immediately know what it was because it's so pathognomonic. Folks are immediately putting it into the chat. A good pickup from someone here asking about rouleau formation. And this is one of those situations where with rouleau formation, you're looking for other evidences of a monoclonal gammopathy, a plasma cell dyscrasia. So if you were seeing the crab constellation of findings, the hypercalcemia, the renal disease, the anemia, the bone lesions, and the bone pain, and you saw rouleau, beautiful. But there are false positives for rouleau, which is that sometimes it's the way that the slide was prepared. And if there's another finding on the blood smear that is screaming another diagnosis, I wouldn't get sidetracked. And I only say that because most folks in the chat are chiming in with the correct diagnosis here, which is, of course, hairy cells, which is pathognomonic for hairy cell leukemia. So I'm going to test you guys one step further because you're all so good. First of all, what is the treatment? And there's two right answers here. Go ahead and put it in the chat. If you know one, put one. If you know both, put both. And we'll give you all 10 or 15 seconds to put the right answer in. Yep, lots of folks are putting cladribine. The other right answer is pentostatin. As hematology and our knowledge of active agents in leukemias increase, of course, you could think about B-cell agents, targeting CD20, for instance. Lots of great answers here. I've also seen ATRA. Remember, ATRA is for 15-17 acute promyelocytic leukemia. So that's the association I would bring there. But absolutely, this is hairy cell leukemia. The classic association here is pancytopenia. So again, red blood cells are down, platelets are down, white cells are down, as well as splenomegaly. And the classic picture that I'm showing here zoomed in is because of the filamentous projections that give this disease its name. This is a leukemia of adults. You all were all over it in terms of the treatments. Historically, cladribine and pentostatin. Of course, if this was a HEMONC boards, you would have to know second and third line and the pivotal trials. But for you all, cladribine and pentostatin is what's in first aid. And another basic science point, this is trap positive. In the chat, someone's put, it traps the hairy monster. I love that. It's such a vivid image to remember hairy cell leukemia. Relatively rare, but if it shows on the exam, you don't want to miss it because it's easy points. The image points right towards the diagnosis.